Are you constantly at the doctor's office with your kids for ear infections or sore throats? Do your kids have restless sleep or loud snoring? If so, they may benefit from an evaluation by an ear, nose, and throat specialist. Joining us today is Dr. Jasmine Hernandez from Mercy's ENT Clinic to answer some common questions she gets from patients. So thanks for joining us today, Dr. Hernandez.
Thanks for having me.
First, let's talk about tonsils. And the most basic place to start is, what are tonsils?
So tonsils, usually when people talk about them, they're the two little things at the back of the mouth there, and they are part of our immune system. So they help sample things that enter into our upper respiratory and aerodigestive tract and help keep us safe from germs and infection.
So what kinds of problems can they cause? What do you see?
Yeah, sometimes, in particular in children, sometimes they can cause recurrent infections. Sometimes they can become overly enlarged as they're working to protect us and can block breathing of children at night, can cause issues with swallowing.
I may be dating myself here, but it seems like when I was growing up, a lot of kids had their tonsils taken out. Is that the case? Is that a common, response to these issues that kids have?
A tonsillectomy is a pretty common procedure, but I've had patients who come in and said, yeah, I had my tonsils out because my sister had her tonsils out. And we try to be a little more selective and make sure that that you're getting your tonsils out for a good reason.
We hear also a lot about adenoids, and I think that's even more of a mystery. So what are those?
Yeah, adenoids are that same ring of tissue as the tonsils, but these sit above the soft palate or at the very back of the nose, and so they can also be involved with issues with sleep disturbance or blocking breathing as you're going to sleep. Sometimes they can also be an issue with children with ear infections as well as with recurrent sinus infections.
And so what can be done about some of those issues?
We see patients for these problems all the time, and essentially, if the tonsils are causing problems, we recommend removal of the tonsils and the adenoids.
And do they typically go hand in hand?
In pediatric children, they typically do go hand in hand. Tonsils and adenoids as well, they tend to shrink down as you get older, but that takes several years to happen. And so if we get a teenager in, their adenoids have usually shrunk down to the size where they're not an issue any longer.
What about ear infections? That is something we hear a lot about.
Yeah.
Do you see that a lot?
Yep, and we're in ear infection season currently, so we certainly see a lot of that. It's something that commonly happens in children, especially between the ages of 6 months and 2 years. And this is the time period when children are developing their immune system, so they're just more susceptible to ear infections.
And tubes is something that we also hear about in addressing ear issues. Do you do a lot of tubes?
Yeah, we do plenty of tubes in our clinic. And again, when you're seeing children who are having recurrent ear infections and getting several rounds of antibiotics, like you said, basically living in a doctor's office, we recommend tubes for their children to help deal with that problem.
And then how long does that address a problem, or how long are the tubes in their ears?
Tubes typically last about a year. I do like to keep track of my patients to make sure that the tubes are working, and when they're done working, that they've fallen out and that the hole has healed behind them so that we don't leave a residual perforation in the eardrum.
Before we wrap up, what else do parents commonly ask you, or what else would you like to relay about things that you see that have to do with ear, nose, and throat conditions?
I think just in general, just knowing that our office, we love our patients, but we especially love our smaller patients. And so really, if you have any questions about ears, nose, and throat issues, I'm happy to see you. We're always working to take care of the patients. And sometimes that means, saying, I don't think you should have a surgery. I think this is normal. But sometimes saying, I think this surgery is really going to change you and your family's life by decreasing infection.
Dr. Hernandez, thanks for joining us today. Lots of good information, especially as we enter the winter months here, and I'm sure that you're seeing lots more of that at that time of year.
It's that time of the year.
Thanks.
Thank you.